Mm. Good afternoon, good morning, ladies and gentlemen. You are all welcome to today's webinar on strengthening health emergencies and disaster preparedness in cities and urban settings in the WHO African region, what we are referring to as urban preparedness. Thank you for making time to join this meeting. We'll start our meeting right away, as the time has just come. The others will join us on the way. So before we start, I'd like to note that this virtual training adheres to the Code of Conduct to prevent harassment, including sexual harassment at WHO events, in line with the WHO principles. So would like to welcome you from the country offices, from the regional offices, and would like for us to share the information about this urban preparedness with the objective to orient all of us on the urban preparedness framework, on the priority countries, but also on the actions required for us to take forward the urban preparedness. We will have several speakers. I will introduce these speakers as we go along. We will have several presentations, and there will be an opportunity to ask questions and also to make comments in the chat. I want to clarify that we will use the Q&A feature for questions regarding the topic and presentations. So if you want to ask questions, you put in the Q&A related to the topic. And we'll also take live questions at the end of all the presentations. You use the chat feature for questions regarding IT or logistics. I'd also want to ask that you use the chat feature to introduce yourself so we can have a record of who attended this meeting. We'll have interpretation facilities in English, French, and Portuguese. You just go to your computer, click on the interpretation button, and you will choose the language that you'd like to hear. Once you choose the language, you click the mute original audio so that you don't get echoes. We just want to note that the interpretation is to facilitate your understanding of what is being said. It is not an authentic or verbatim record of the proceedings. What we consider authentic is the original speech being given by the presenter. If you want to have live transcription of what is being said to some level of accuracy, you click on the show captions. And if you don't want it to appear, you can click on hide captions. But show captions can try to show you what is being said. I want to also highlight that this session is being recorded, and we take your attendance as consent to be recorded. We will have these recorded materials shared with the participants in the days following the webinar, and you can use them for your benefit. As we continue to improve our training programs, we'll value your feedback. So at the end of the session, we'll highly encourage you to share your thoughts and suggestions, and your inputs will help us to tailor future sessions to better meet your needs. So a survey will be shared with you. Please take time to fill in this survey. On the agenda, we are having the introduction to the meeting, and for your personal introductions, please use the chat. We will have the opening remarks by Dr. Dick Chamla. Dr. Dick Chamla is the Regional Program Area Manager for Emergency Preparedness in EPR Afro, based in Brazzaville. He's our lead in emergency preparedness, and he will give the opening remarks. We will have an overview of the urban preparedness framework by the senior colleague at headquarters and the actions needed for its implementation, Dr. Ludi and Dr. Adam, respectively. Then we'll look at the Afro priority countries for implementation and what needs to be done in these Afro countries. We'll bring in a presentation by Mrs. Fatima Tafida on logistics prepositioning for emergencies in urban settings. And lastly, we will also look at experience sharing from PAHO. We have a colleague from PAHO who will share with us experiences on how they are going forward with this urban preparedness area of work. And lastly, we'll look at the next steps led by Ludi and Vivian. And we'll have an opportunity, hopefully, if we keep our time well, to ask live questions. So with that, I want to thank you all again for your coming and open up the floor to Dr. Dick Chamler, our Program Area Manager, to give his opening remarks. I hope he's on the call. Dr. Chamler, over to you, please.
Okay, actually, I'm here in the call, Miriam. Appreciate for the introduction.
Yeah.
Okay, ladies and gentlemen, esteemed colleagues, good afternoon, or wherever you are. It will be either in the evening or in the morning. And welcome all of you to this a critical webinar on urban preparedness hosted by WHO Regional Office for Africa in collaboration actually with our colleague in Nairobi Hub and the WHO HQ in Geneva. So we are here today at the coalition of the stakeholders, experts, and representatives from our member states and partners across Africa and beyond, in order to discuss a relatively new area of work on strengthening health emergency preparedness in cities and urban, in line with the World Health Assembly resolution adopted in May 2022. As you know, ladies and gentlemen, our region has been the epicenter of the public health emergencies, which have claimed lives and had high economic costs by any measure. The public health emergencies have also highlighted the critical gaps in our health systems and emergency response mechanism, and transitively underscored our lack of preparedness for such an emergencies. Unprepared urban environment, which is usually overcrowded, we could amplify the catastrophic effects of health emergencies. And it also exacerbates the spread of any public health events. We all still have the memories of the threats of Ebola outbreak in Kampala, the time it happened, in which it necessitated us to have a response plan only targeting in Kampala, urban area in which it was affected. And also we have the memories of the cholera outbreaks, in which we have now in the major urban areas in Lilongwe, Malawi, and also in other countries in Africa, is in Lusaka. And all the public health events which have happening in urban areas have been associated with high mortality and morbidity. And as you all know, in Africa, the landscape of urban infrastructure is changing. We have an increasing population movement in urban settings, and also as well as increasing populations in these areas. In today's presentation, as you have heard from my previous speaker here, you will have an opportunity to hear from a group of experts on the recent development in advancing urban preparedness in Africa. It includes a presentation on urban preparedness frameworks, a partnership around urban preparedness globally, and also the upcoming events alongside the areas of urban preparedness. We all recognize that urban programming is not a new area, as other programs, as EPI, Expanded Program of Immunization, UN Habitat, the World Bank, OCHA, and also climate change advocates have also created actual urban initiatives. It is our aim to ensure that these frameworks talk to each other and optimize opportunities to improve urban preparedness in Africa. At the end, I would really like to express my sincere gratitude to each one of you for participating in this webinar. In your dedication, commitments to urban preparedness are commendable and deeply appreciated. I will now hand over a mic to our moderator to our next speaker. I really appreciate for this opportunity and welcome all of you again next year.
Okay, thank you very much, Dr. Chamla, for those remarks, clearly highlighting the importance of urban preparedness and the special way urban centers are affected by the emergencies. Hence the need for us to really talk about or plan more carefully about the urban preparedness. I will now hand over to Dr. Ludi Triantoro. Rudy, I request that you first introduce yourself before you give the overview of the urban preparedness framework. Thank you.
Thank you very much. First of all, thank you to Dr. Dick Chambla, who has provided the opening remarks regarding this important webinar and the opportunity for WHO headquarters in sharing the latest updates and progress about our new initiative in terms of urban preparedness and the importance of urban preparedness. So my name is Rudy Surantoro. So I'm the head of unit for the multi-sectoral engagement for health security. So our unit is under the Department of Health Security Preparedness Department, which is dealing with the International Health Regulation Monitoring and Evaluation Framework. For those of you who understand the process of the SPAR process, the JEE process, the National Action Plan, and what is important, all of these different steps of stepwise approach of capacity is required a very strong cross-sectoral collaboration. So I'm also responsible for the resolutions of the last year resolution of the urban preparedness. So I'm leading the unit for the implementation of the urban preparedness framework, but is also overseeing the vision in terms of how we can implement this even further and make it much more practical and beneficial, not only just for WHO, for the country, for the partner, but the people at large, people at the center of the conversation. So Dr. Miriam, thank you for moderating this session. I'm pleased to see you again. And so if without any further ado, I can start the presentation, yeah?
Yes, please go ahead.
Thank you so much. So the presentation is about strengthening health emergency preparedness in cities and urban setting. So I would like to start the issue on where we are coming from. We are coming from on the issue of the reality on how IHR or international health regulation is being implemented in the country. Now, as you know, there are 3 levels, and even some country even more than 3 levels. But the IHR interpretation or implementation, it depends on how is the national will be ratifying to the subnational and how subnational is reflecting to the local authorities. Now, according to the lesson learned during the COVID-19, and this is why Dr. Miriam and colleagues and others, why member states is calling the need to have this very strong urban resolution, it is because there is this connect between national, subnational, and local level during the COVID-19. It is a very challenging moment in terms of policy, in terms of division of work, in terms of building infrastructure and using the assets as necessary from different sectors. So this is the way that the member states reacted, that the information gathered is not very clear from the national level, or it takes some time for the national level to conclude as a national policy. In the meantime, subnational keep receiving and opening the borders. So there is a disconnect in terms of how the coordination during the COVID-19. But most importantly, this urban preparedness framework is linked to the IHR monitoring evaluation framework. So you're going to say, where is it? Well, as I explained, our responsibility and roles is to support countries to build their capacities progressively from the self-assessment process to the voluntary joint action evaluation to in-depth of risk and vulnerability assessment in terms of after-action review, intra-action review, and build that into a very strong, a very cross-sectoral national action plan, of which we will continue with helping the country by mapping what is the available resources. All of these is related into a cross-sectorality, if you can see from the below, that is required. And this is where it's leading towards much more, is coming back to where is the beneficiary in terms of the country, is the local authority, is the subnational. So we need to translate all of these into an urban preparedness context, of which we need to contribute to the preparation for the country at the national level if we implement the urban preparedness framework that can fit into the JEE process, that can fit into the reality of the national action plan. And then hopefully this is part of the future and considered at the national level for monitoring evaluation framework. What do we have is that I don't need to repeat, but this is the facts that urban environment is very unique, in terms of vulnerability and risk profile. As you can see, that is always very challenging during the Ebola outbreak, during the Zika outbreak. It is normally linked to the high density of populations. It is also the urban is depending on different city, different country in terms of how they design, how they are planned and managed, and then how the local authority capacity is really out there, is really available. And then integrating between local and municipal authority to the national level is something that we need to build more and more for the benefits for the country, so that we get the real picture, we get the real data, and we get supporting the capacity, but it's also the capability of the country in responding in the future. It is also can benefits to different things in terms of saving life. Definitely, that's our work, but it's also national security and emergency in general. And then the COVID-19, it is providing that opportunity on how the three level should speak each other in terms of authority. And then in terms of WHO, for you, colleagues who are in the country level, you can even further collaborate with the local authorities, because we have now the mandate of the resolution, we do have the framework, and this is where we can make the difference. Remember about the game changer that the DG vision is already putting forward. This is the game changer at what we do. So to get an overview of the ecosystem in terms of why urban is such important. So in this slide, you can see the interlink and the connectivity between the air pollution, the global travel and trade, the increases of climate change that would kick off in terms of the vector-borne diseases, and so on and so forth, and the expansion of deforestation would lead in terms of animal, because it's human-animal interface, in terms of animal moving to city, in terms of finding food security, right? And that is the reality that we are looking at. We're going to have a multiple density in terms of the population growth, the increases of threats, but it's also human, animal, and other influencing factor, climate change, that would impact. And where is going to happen? The first thing first is happening in most of them in the city, where the center of economy. So WHO work in cities and emergencies is really linked to the international health regulation. The resolution is a request from the member states, so it's not initiative by the Secretariat, to specifically support strengthening health security and emergency in cities and urban setting, but it's also very flexible enough in terms of how we can address it to specific country. For instance, Vanuatu is a very small country, so it doesn't make sense only just a city, but it's also a province, or in other words, in the state by state context. We do have a global framework and operational guidelines, which is already published. We already established the technical working group prior to the adoption. So this is something that we applauded. All the regional colleagues have contributed to this technical working group, both on the framework as well as the guidance. And of course, this is the opportunity for WHO to be even much more present in terms of community engagement, in terms of hands-on, in terms of the reality in front of us, how it's going to happen, how is translating the international policy to regional policy to the national policy. It's actually making the difference and impact to the country at the local, at the subnational level. So just to recall, this is the resolution is focusing on urban health emergency preparedness. The co-sponsors are 18 countries, and one of them is from Africa is Botswana. We would welcome, it doesn't mean that we work only with this co-sponsored, but since this is the resolution, the governing bodies is advising us in terms of working very closely directly with this country in terms of how they will see the implementation in the future. The resolution requests WHO also to focus on the unique vulnerability of cities. There will be more cities around the globe. There will be more trade around the globe, and there will be more people travel, and that's what we have in the next 5 years. Therefore, there will be more threats coming in, both on the African soil, beyond African soil, but it's also from outside to Africa. So this is very important to take a note. And our perspective is really looking at the implementation of international health regulation. So this is where our role and responsibility, and we should work with the local authority. We should work with the local partners as well, regional partners, and this is where we can make the difference. So in terms of the opportunity, as I mentioned a little bit, there is so many of our work is focusing at the national level. How do we know it's going to be implemented? So the difference with this opportunity right now, we are actually implementing, right? Because it's linked to the JEE, it's linked to the SPAR. It is an opportunity to break through how is the JEE and the National Action Plan is actually reflected, what the local level needs and gaps is, right? And then also contribute to the UHPR. I give you example in Thailand. They recognize that they are pretty strong at the national capacity, but they're pretty weak at the local and regional and the subnational capacity. So this is where we need to build even better, so then we can at least one round advance, than the micro. We are faster to address this out of the box thinking by engaging, by supporting, and by informing the local authority and aligning between the 2 and 3 level of authority to work together towards common goal. The momentum is there and solidarity that we can build because they understand right now with the COVID-19, they understand the threats, they understand the importance, and also they would be more appealing right now to listen about what is the international health regulation, particularly those who are non-health sector, because health sector is convinced about what we do. The challenge is how can we convince the other sectors to support health sector? That is where make the difference in the future. So how the framework of urban is look like? So this is contributed by many of you, many of the regional, representative when we develop this technical working group. So this is the, is spread into the 8 key areas, from the governance, financing, the importance of the cross-sectorality at the city level, at the urban level, the high population density, about movement of people, community engagement and risk and crisis communication is a huge undertaking because this information is coming through in terms of the local language. It's no longer just in English, but it's in the local language. And this is where the confusion of building trust between the national policymaker with the actual population at the city level, right? The group's vulnerability. So you have city with the specific, challenges. You have city with aging population. You have city with, other infectious disease population, but it's also different economic status within the city. So there are many different challenges in terms of risk vulnerabilities. It is the data that we can help the urban level to think about what they can do or what we can leverage or what they're planning to do anyway in the development side. So this is evidence of information of data will help them if they have a growth population. They are planning anyway to have a better city preparedness in the future, or better urban planning in terms of digitalization, in terms of better infrastructure. We should be aligning in terms of a capacity that should be aligned to the development of infrastructure they're planning to do. Commerce, industry, and businesses, this is normally focusing in the city areas, right? Because it's although it's happening at the provincial or at the state level, but mostly city is where the center of economy, where everybody's working, where everyone is using the platform and using the structure of city level to in the future that we need to do is to secure and to protect the economy by having a very well-functioning urban preparedness, and how we can work together with the key areas such as food distribution, such as airport authority, because the airport authority is not under Ministry of Health. They're listening to the Ministry of Transportation in some cases. So this is where the reality and the opportunity for us to work face-to-face and to work and listening each other, and how we can support together with Ministry of Health at the national level to deep dive some areas. Last but not least is health and other essential services. So you can see there's so many diagnostic centers during the COVID-19. How many belongs to private and public? How many belongs to the Ministry of Defense? How many belongs to the other ministries, such as laboratory for animal diseases? All of this we need to map. We need to make sure the country office, the WR, knows exactly what is happening in the country for the benefits of better preparedness and better responding in the future for the country that would protect the economy, protect the population, billion as one, the GPW 14 is our role to protect from the emergency. So this is very crucial to understand in terms of the 8 pillars. What we do is always looking at collaboration at the national level. We need to aligning it. And then what we do is also always with a step-by-step risk assessment, monitoring, then we do capacity building. And most of all, we need not just to stop after capacity building is done. Once the capacity building is done, our job is really to build the partnership from different levels, locally, nationally, and sub-nationally, but it's also at the region and the global. It's all connected. And one is connected, then this is an opportunity to build, to address infrastructure in the city that would align with the capacity required, would align with the workforce that is needed, would align to the policymaker.
Lodi, please summarize.
Oh, sorry. So this is then the next will be Adam it's the same presentation. So and then the next one is the guidance. So the guidance is just of how you operationalizing the 8 pillars. So this is the guidance. And then what I do is what I said about the two ways of working together, regionalization and the contextualization, because not everybody is the same. There is no one size fit for all. So some is very unique, some is very specific, some is autonomous. We need to address what we do in the capacity building, tailor-made to the needs of the population and the needs of the country. Oops. So this is my end of my slide. So what we do is really cross-cutting areas. This is an opportunity. Either we address it what the need at the city and the urban level this much, or we focusing on a specific area. It is up to the local authority to decide. So this is the area that I can name off that we can use the opportunity in the context of One Health in the 3 level, infrastructure in the city, point of entry, data surveillance, specific disease like respiratory influenza, dengue, and other AMR. We can use this as an opportunity to actually applying it in the case study in the city. Preparedness investigation, biocity, biosecurity. Many city is not, the target of any biological attack is in the city, not in the rural area. Is going to address those issues as well that we can work with. So all of this is a potential for partnership, potential for key partners, technical partners, funding partners to work with with the region and beyond. So I'm hoping that we're gonna have more conversation about this area of work, which is adapted and suitable for certain city. And then I'm gonna leave it to Adam. Adam is in my team lead. And Adam, why don't you present yourself and then follow the presentation.
Thanks very much,
Thanks.
Ludi. Yes, it's lovely to be here with you all. So my name's Adam Tilloween, and I'm a technical officer working in Ludi's team in headquarters on urban preparedness in particular. So I'm going to be very quick. Don't worry. But I just want to talk a little bit about how we actually then move to the implementation on the ground in countries. So here you see there are a number of tools tools, publications, and resources that exist. So there was a technical working group that met 6 times towards the end of 2021, and there is a report published there summarizing the key recommendations and findings from that group. And that was a group that was made up of country representatives from all 6 WHO regions, as well as partners, experts, and leading voices in the area. We also have the framework and the guidance, which is there. There were a couple of tools that were created specifically for COVID-19. But the main thing to say here is that the idea is not to reinvent the wheel, reinvent everything, and give it an urban framing. The idea is really, how do we take the existing tools and processes that we have for health security preparedness, for health emergency preparedness, and how do we use them to build the capacities for preparedness at the city level? So this could be from, we're going to hear later from our colleague in PAHO, for instance, for the strategic risk assessment tool. It could be tools, One Health tools that we've been working with the team on how they can be adapted and applied at the city level. It's also your SIMEXs, your reviews, and different things. So it's really, how do we work with those technical teams to apply those activities at the city level, or to integrate the city authorities, the municipal authorities, into those activities as they go on at the national level. So our national planning work around NAPs and around planning for disaster management, for example, how do we better integrate the local authorities into that? And then this is the final slide that I'm going to touch upon, and it's very briefly, again here, just to talk about the 3 levels, that this is really is an approach that is fully integrated across the 3 levels of the organization. So the global publications and tools have been published at HQ level, but really what we've been doing, the approach is to work with all of the different regions bilaterally to develop the regional priorities and plans for each region, because the needs are completely different in each region. So this is really a regionally led process. And of course, HQ is there to support the regions as we can. And then, of course, at the country level, that's where really the support is given to the countries and the cities to implement the key activities. It's, of course, all of the relationships with the national level and the local level, and to coordinate across, to the regions, and then also up to headquarters. So it's really a 3-level approach, and regions are there in the center for a reason, because they are really looking at different ways to action this globally. So I'm going to stop there, and we will share the presentation afterwards as well, so you can see the information in more detail. Thanks, Miriam. Back to you.
Yeah, thank you, Ludi and Adam, for that overview of the urban preparedness framework and actions needed for implementation. Colleagues, I think you have got an overview of the resolution that was made in May 2022 about paying attention to urban preparedness. I think this was heavily informed by the experiences that we had in COVID and in other outbreaks. And you have seen the global framework for preparedness and the key different areas. I think the key issue they mentioned here is contextualization. It is a framework that we can contextualize within our city settings and the need to adapt tools to city environment or integrate city authorities in the national implementation of these tools. But the key is to pay special attention to preparedness at the city levels. I hope that this is now clearer to all of us. I will now move on to Vivian. Vivian will present about the priority countries within AFRO for prioritization of this framework. Vivian, first introduce yourself, please. Slideshow.
Thank you. Yes. Can you see my screen now?
Yes, please. Go ahead.
Okay. Thank you. Thank you so much, Dr. Miriam, for giving me the floor. My name is Dr. Vivian Fosso. I am a public health specialist, and I work at the WHO regional office, and I am the technical officer in charge of overseeing the urban preparedness initiative in the region. I'm very happy to be here, and I will quickly provide an overview of the priority countries or cities that have been selected for the implementation of the framework. My slides moving?
Not yet.
Are they moving?
It has not yet moved.
Let me stop sharing and share again. Sure. Can you see my slides now? Is it moving now?
Yes, it is.
Thank you so much. So yes, okay, thank you. Yes, in AFRO, we have 8 countries that were selected for the implementation, the initial phase of the implementation of the urban preparedness initiative. And we used the 3 main criteria to identify the priority cities within these countries. The first criteria being the city considered as an international hub. And then we also selected cities with specific political and economic importance. And lastly, we look at cities that are also considered as important point of entries. It is not moving. We use this. All right, so yes, the first country that was selected is Botswana, and the city is Gaborone. As Ludi already mentioned, Botswana is the only co-sponsor of the Urban Preparedness Initiative in AFRO, with a large population, approximately 250,000 population at the capital city. And the context is also characterized by flood. The city has reported in the past, in 2014, flood is in Limpopo, and also in 2016. The second city that we selected in AFRO is Lagos. Lagos is the largest city in Africa. And Lagos has also faced numerous health threats due to the very dense population and the growing urbanization. And also Lagos is considered as a significant economic and commercial activities city. We also have a lot of displaced population and informal settlement communities in Lagos, with a high number of road traffic accidents involving the Okada riders. Then in DRC, we selected Goma. Goma also has a large population, yes, and also has a high population density and rapid urbanization. We also have a significant informal settlement and slums area in Goma, and the proximity with the Nyiragongo volcano, making it susceptible to volcanic eruption. But also note that Goma is a point of entry. It's a cross-border city with the neighboring Gisenyi. That's the first city in Rwanda, the first neighboring country. Then in Rwanda, we selected Kigali, the main reason being that Kigali is like a model for other cities in Africa with well-organized infrastructure and strong leadership. We also have high population density in Kigali, and the city is vulnerable to infectious diseases like Ebola and even cholera. Now looking at Rwanda, we selected Gisenyi, which is bordering DRC. There is also rapid urbanization of Gisenyi due to the proximity with Goma, and also a lot of trading activities that are happening there. We also have vulnerability. Gisenyi is vulnerable to potential limit eruption and methane gas release from the lake Kivu. And as this city is bordering DRC, there is also a high cross-border dynamics in this area. Lomé in Togo was mainly selected because of the important maritime hub in the Central and Western African countries. So Lomé is susceptible to various health threats due to increased trade and human movement, but also prone to natural disasters like coastal erosion and floods. Now in Cabo Verde, we selected Praia. Cabo Verde is an island nation in the Atlantic Ocean, and Praia have faced challenges due to its isolation and vulnerability to climate-related diseases like hurricane and droughts. Now in Nairobi, Nairobi was selected as the city in Kenya, also because of the dense economic hub of the city and high population density. Nairobi is also facing health threats like cholera, and has reported occasional flooding. For Dakar in Senegal, that is a city that was also selected. It's the largest city of Senegal, high population density also, and significant industrial and commercial activities. So it's worth noting that Dakar is located on the Atlantic Ocean, making it susceptible to flooding and other weather-related disasters. So these are the main cities that were selected in Afro to pilot the implementation of the Urban Preparedness Initiative for this first phase. Thank you for your attention. Over to you, Chair.
Okay, thank you very much, Vivian. These are 9 cities that have been selected in 8 countries. Maybe you could have mentioned how long the pilot will be, and how shall we move from pilot to other countries, and the other countries also be working on this, even if they are not in the pilot. You could add quickly and we finish.
Okay, yeah, Dr. Mia, we shall discuss that in the next step.
Okay, all right.
Thank you.
Then we move on to Mrs. Fatima. Fatima is going to talk about prepositioning of supplies for preparedness in the urban settings as also a part of the preparedness. Over to you, Fatima.
Thank you very much, Dr. Miriam. Good morning, good afternoon, good evening, everyone. My name is Fatima Tafida. I'm currently the Regional Supply Chain Lead for Emergencies for Afro, sitting in Nairobi, Kenya, and I'm from Lagos. Yeah, this is which makes this a very exciting topic for me because I'm a Lagosian. I've spent 3 hours in traffic trying to get to school in the morning before. So I definitely understand why this is important. This is OSL, Operation Support Logistics. So we keep things short and sweet. The objective here today is to focus on pre-positioning. And we're going to talk about why pre-positioning, what to pre-position, and how to do it. And I'm being supported by two of my really smart colleagues, Alex and Miguel. If you'll allow me, Dr. Miriam, they can quickly introduce themselves.
Yes, let them go ahead quickly.
Sure. Alex, Miguel.
Okay, let me start. My name is Alex Freeman. I work with Ms. Fatima in the Nairobi Emergency Hub as Health Logistic Officer. Thank you.
Thank you. Miguel?
Yes, this is Miguel. I'm also based in the hub, Nairobi hub. I'm flying. I'm deployed for emergencies around all Africa. So now I'm in the car supporting the car hub. Over to you.
Thank you. And when you're answering questions, don't be shy. We love to see your faces. Okay, with that, why? What is pre-positioning? Stock pre-positioning is basically part of preparedness, and it's supposed to improve responsiveness. And the idea here is about response timelines. When something hits the fan, you need to make sure that the supplies are ready to go. And pre-positioning of supplies before a disaster happens enables us to speed up the response and reduces the burden of the emergency at hand. And the pre-position needs to reflect a country's plan for dealing with health emergencies that are likely to occur. We heard from our lovely colleagues in HQ earlier about contextualization. So being a Lagosian, I can tell you that because of the traffic, the rain in Lagos, we call the rain get on with your life because you don't stop because it's raining in Lagos. So, you have to understand that what comes with rain, malaria, what comes with the mosquito, all kinds of diseases. So when you're coming up with this risk assessment for Lagos, what are you thinking about? So here today, we're talking about an urban setting. And what is an urban setting? We got a very brilliant definition by Dr. Chamla earlier. So I will go with the street definition, right? It's just a dense population in a developed environment. And what are the logistical implications? This is a picture from Lagos. This is a normal day in CMS in Lagos, very close to where my father used to work at the ports. This is what it looks like. There is no rhyme or reason. You can buy a rabbit, you can buy carrots to feed the rabbits, all in this traffic. So what does that mean for logistics? Number one, it's a city, everything is expensive. Dr. Chamla said the same earlier. The flow of traffic is really, really terrible. In fact, we've known that some people come to Lagos and they spend 2 weeks crying because what kind of a place is this? How do people function here? Some of us love it, some of us hate it. And of course, security is also a concern. When it comes to storage and distribution of goods, security is a concern. Am I going to pre-position an iPad or a very fancy camera? Is that necessary? This is a consideration. So depending on your setting, at this point, maybe I stop for 1 second and I just ask the participants to drop what you think are the factors to determine your stockpile in an urban setting. You can just drop them. We'll look at them later and send you some kudos. The factors are really, for me, I can spend my whole day here thinking about the factors. One is your economies of scale opportunities, available funding and cost. Everybody's talking about there's a crunch post-COVID, there's no money. How much do you have to pre-position? This is something real. Am I going to go and pre-position things that are expensive? Can I afford it? Can I afford the storage? Then the disaster risk profile, looking at Rwanda and where people are so organized in Kigali, all the boda guys wear helmets versus Lagos. Are we do we have the same risk profile in these two cities? Right now, sitting in Nairobi and Lagos, is it the same? Am I considering the same factors when I am looking at the likely diseases? Also, we talk about supplies, the storage requirements. Do you want to, I remember during COVID when there was this one vaccine that was stored in -80. The thing died before it went anywhere because who has -80 storage? Everybody has up to -25 in their house if you have electricity, right? So this is a very important factor. Logistics and security infrastructure. This one, again, very interesting. Do the police even listen? And do people listen to them? Are you going to call the police or the military to support you in your response? Do you make that relationship before the response or during the response? You know, is your military part of your infrastructure of emergency response? We've seen some amazing examples, I guess, even during COVID. Here in Kenya, we had a very senior official from the Kenyan military supporting emergency response during COVID. Is this something, you know, is it part of your infrastructure, your support infrastructure? The shelf life of the item. Reagents, 9 months from production to expiry. Can you afford to pre-position reagents? If yes, how many? You know, product attractiveness. I mentioned the iPad earlier. Is this something somebody would love? And how am I securing it? Vendor agreements. This one is my favorite. I spent many years in procurement. And am I waiting until I have an emergency to call, to have a contract for transportation or delivery of goods? Should it be done before or after or during? So you can see there's so many factors to consider. And my favorite factor is local availability of items. And here I will give some kudos to Uganda, Dr. Miriam, your country. I remember when we were there last September, Uganda actually said the national medical stores purchases 75% of everything they need during emergency response is locally available. So do you have that market in your city? Do you have those contracts with those vendors? Or is it something that needs to be developed? If it's something easily available, then you just have your contract and you call them, you have your service level agreements, life is good. Again, like I said, I don't want to bore you too much. I could go on here all day, happy to answer questions. And you know, they say the proof is in the pudding. This is an example of actual emergency that happened in Kenya. Alex on the call is the guy with the dreadlocks in the picture at the bottom. We got a call from the Kenyan government on the 1st of February. It was late at night. And there was a huge explosion in Embakasi, close to the airport. There was a gas explosion. You can find this on the BBC, actually. And within a few hours, we were able to send them trauma kits. Why? Because we had pre-positioned trauma kits. And this, you can see the numbers. There were 271 human beings affected by this explosion. And we even had some loss of life. And out of these 271, there were 25 children. And we got such, this top photo is the PS Health, very senior in the ministry, and that is the WHO rep for Kenya, Dr. Diallo. And we made the news because we were able to pre-position effectively considering these factors, deliver when it was needed. Why? Because we had contracts for transportation, we had the right goods stored under the right conditions. So pre-positioning, I mean, Vivienne and team, kudos to you for choosing those 9 cities. Those are like, the spectrum of challenges is so amazing. And I think if we can, you know, come up with a good way to work on this, it will have a huge impact and save a lot of life. So that's it from me. Yeah, this is Embakasi in Kenya. So how can we help? We're here to support you in making these these decisions about pre-positioning. And I'm just gonna stop here. Thank you.
Thank you very much, Fatima, for that interesting presentation. Pre-positioning. It highlights the importance of pre-positioning for preparedness in urban settings. What you would consider preparing. Of course, you contextualize. And we will put that into consideration as we move forward. Next, we'll go to Dr. Alex from Camacho from PAHO. PAHO has already started the implementation, and they'll share some of the lessons learned from some activities that they have implemented for us to learn from. Over to you, Alex. Alex was on the call. Is he on? Vivian, is Alex on the call?
Yes, I can see Alex connected.
Alex, if you're speaking, then you are muted.
Thank you, Miriam. It just takes some time crossing the Atlantic, the message, but I'm here.
Okay, please go ahead.
Thank you so much. First of all, thank you for this kind invitation. I'm really honored to participate in this webinar. Kind regards from the Pan American Health Organization, the WHO Office for the Americas in Washington, D.C. As I said, I'm really excited, as well my team, to learn from you, really to learn from you, and also sharing some little experience that we have had in this process. Just can you please confirm that you are seeing my screen, please?
Yes, we are seeing the slides. Please move on.
Thank you so much. So also I want to highlight and also to thank the tremendous support that we have had from Ludi's unit from WHO headquarters. Ludi, Adam, they have been really keen on this process, and also we would like to share some exciting news following this. Also these few slides that I'm going to share. So the project overview has been set in 4 phases. One of them, the first one, started in 2023 with the piloting in 3 cities: Quito, Bogota, and Tegucigalpa, Ecuador, Colombia, and Honduras in Central America. And it was based specifically on risk assessment and also the identification of the strategic actions pre-aligned to the urban preparedness framework, and also to I will say very good connected with the strengthening of capacities and all the documents that have been produced, but mostly with a resolution that was launched in 2022. So now we are moving to the expansion to 5 cities, as well to the implementation of the actions that were considered priorities. And along this, we are also developing a monitoring evaluation system, as well working on the dissemination of results by the end of this year. That will be key. So it means that phase 2 and phase 3 will be worked a lot on this year, of course, also 2025, but also like to say that we are now started working in phase 4 that will be mainly focused for 25-26. And that will be mainly research, South-South cooperation strategies, and of course, the project sustainability with the cities that are involved. What was the methodology for phase 1? So we started with a preliminary assessment, and what were the cities that had some conditions to work with, and also the designing and execution of the 3 pilot projects. And then we moved with the country, PAHO, WHO country offices, and with the municipalities, and some training regarding in urban preparedness, in the key areas of work, the cross-cutting areas, and some other aspects, as well with the tools and guidelines that were needed to work with. So before a preliminary assessment that involved the use of the strategic risk assessment toolkit and others. So then we moved to 3 very important workshops in each of the cities that I mentioned. What we did there is the first day we had a strategic risk assessment. I will say a very compiled version of the original STAR workshop. That was also one of the lessons learned that I would like to mention in the following slides. But what gave us, it was very a good understanding what were the priorities and also what were the needs where we have to focus on. So with that, we had a pilot project evaluation and also the development of a roadmap in terms of what we could do in Latin America, and also involving also another areas, another subregion like the Caribbean as well, involving small states, small development islands. So one of the key aspects of the methodology for phase one was the coordination and the connection, the technical support at the three levels that Adam and Ludi mentioned before. It was like a very good connection and supervision with the WHO headquarters team, with Ludi's team, at the PAHO level, at the country office level, and of course with the group that we created with the municipality, and in two of the three cities also with the Minister of Health. It was also important to say that it was a very important challenge in terms of politics. Ecuador was switching of government. We had to work with a new municipality in Quito, and also facing some political issues between Minister of Health and municipalities in Tegucigalpa. In any case, we were able to complete this process until August with the three high-level workshops and also sharing some of the results and working in a comprehensive proposal. One very important aspect to mention is that even when we don't consider that it's needed a new tool for strategic risk assessment, it was very important to understand that cities may have different contexts, different realities, and I will say also even approaches, contexts, and political challenges in, for example, big cities like Quito. Quito is a very well-developed city, but also it has a lot of challenges in terms of different and multi-hazard aspects. That's why the multi-level, the multi-sectorial, the multi-hazard and a risk-based assessment approach was needed in this context. In terms also in health care infrastructure, in hospitals, we may have also to consider different institutions, public, private sector, as well as different type of infrastructure, as you may see in the bottom of this picture. So some lessons learned from initial actions are that the involvement from the very beginning, from the high-level authorities in the country, with the Minister of Health, and of course, with the commitment of our PAHO, WHO country offices in the ground was really a key. Creating an executive teamwork group was really, I would say, one of the main goals, the main results that we have in this process. And also always moving to give them the leadership, to give them the right to decide what is the best approach, the best way to implement this process, as well their priorities, of course. Some very important aspects also was the involvement of some key actors. I will say a lesson learned from this was also the need to have all the views in the room by the time of not only assessing risks, but also defining the priorities. And I'm saying this because in one of the cities, we had some kind of bias to the strategic, to urban planning bias. Mostly, I would say, focused on disaster risk management rather than looking also IHR capacity. So that was so important also to guarantee that we have all the actors, all the approaches, and of course all the capacities, all the sectors in the room by the time of working in the very first stage. I will say it's the most important one in terms of the strategic planning, and that's why the workshop methodology also, as I said, with these considerations was key. very important aspect in terms of the workshop management and the time frame was really really a key one. We had the support of an expert on urban planning. I will say one of the things that we'll also add in the future is to have, by the same time, an expert with the approach on public health approach, with some knowledge also, or with a good knowledge of emergency preparedness, disaster risk management as well, so we can really connect these two aspects. It is not easy to find someone who could handle all the urban planning aspects and the public health approach. In any case, I think we did a pretty good job in the 3 cities. The involvement that we had in the commitment and the engagement that we have in at least in the 2 of the 3 cities was really, really great. And I will say that one of them was really an issue because of the political issues that was in Central America. But in Quito, and especially in Bogota, really had a very good participation, also involving the academia in Bogota, that I think was a plus. So the products in the phase 1 was, as I said, the risk assessment results, the strategic actions that had to be discussed in some workshop, and also the quick wins approach. It means the feasibility, the impact, and the alignment, so we can have some concrete actions and results in I would say, in a reasonable time frame. So in that regard, when after we had the strategic risk assessment, in a very clear message also is that, yes, it is important, and we are really aware that we need to work on the strengthening of IHR capacities, but it is important also to have this multi-hazard view approach, because cities, it is not only, diseases. In fact, in the 3 cities, 3 of the 5 priority risks that were resulted in very high, were not necessarily infectious diseases, but earthquakes, volcanic activities, mass movements, and some other aspects that you also, of course, understand that have a lot of variation depending on the country, depending on the region, even depending on the city in the same country, and so on. But just to clarify the process, so we started again with the strategic risk assessment with the STAR. Is the same STAR that we use it, but we have to, in some of the cities, for example, in Quito, that has a different administrative management within the city, we have to run at the same time 6 strategic risk assessment, depending on the area of the representatives that were from, because that's how they wanted to do. Honestly, I wouldn't repeat that again, because at the end, by the time that we define that the response to those emergencies or those disasters won't be focused in an administrative way, but as a city, as a management, as a whole of management, I will say it was very important to take that suggestions from them, but at the end, the results, I think, will be the same by the time of prioritizing the risks that they had. So after the risk assessment, so we developed some strategic actions defining not only the needs, but the priorities, and what we used after we have at least, I would say, for example, for Quito, 25 strategic actions that were identified. Say, okay, it is not feasible to implement all those 25. Let's we propose it to use a quick win approach in considering feasibility, impact, and alignment. Feasibility, considering time, cost, easy of implementation, if was necessary or not, some change, for example, some big intervention in terms of laws or some normative that were out of hands. Impact in terms of course, first saving lives, the continuity of health services, and of course, in the alignment with the IHRs and diaphragm of disaster risk reduction capacities and goals, and of course, the urban preparedness and the cities priorities that of course will mark definitely the way how we will implement. So development of strategic actions that I was mentioned was also considered depending a very important aspect when we were considering the feasibilities in terms of time, 1 to 6 months, 6 to 2 years, and 2 to 5 years. So why? Because not only resources, not only political aspects that we have to consider that always changing in the cities and also in the countries, and also the involvement of the government depending on that. And at the end, what we ended up with was with an action plan, defining at least a 2-year action plan, focusing, of course, the quick wins approach. It doesn't mean if something was marked as low as priority, it was not necessarily out of the plan, but giving a 3rd or 4th priority, depending on the semester, how we could implement in 2024 and 2025, and the roadmap as well. A very important aspect to mention is that we consider a lot and we focus a lot in the urban health infrastructure assessment with the implementation of the resilient hospital approach, of course, using the safe hospital evaluation process, but including the strategic disaster risk assessment in health facilities, the STAR-H that was developed and was created in PAHO as, I will say, an adaptation of the original STAR, but very linked with the safe hospital process, but also including some other aspects like climate change mitigation and others. And of course, for example, these and the right upside, you will see the INGRID-H, that is the inclusive facility assessment for persons with disabilities, including others as well. These include also a lot of tools that will be needed to implement that PAHO has developed, and we are happy to share that most of them are being translated in English and some other languages. Portuguese is one of them, for example, and that are needed and of course important to implement that. When we are saying this, in now moving in specifically in the critical infrastructure, specifically we are working in the resilient hospital approach also. That
Alex,
we have
please try to move faster.
Yeah, and we'll finish in 1 minute. That we have also be able to implement. I will say that is one of the aspects, is one of the plus that we have gained through the urban preparedness implementation, is that the strengthening in the implementation of the resilient hospital approach that has 3 phases. So in some of these countries, we have started already with the risk assessment of some health facilities, and the implementation also of safe hospitals as well, moving with a smart hospital approach that involves climate change mitigation, as I said. In all the process that we are doing in terms of not only resilient hospitals, but in hand to hand with urban preparedness, we are using the PAHO Health Emergency Disaster Risk Management training standards that are applied through the process, so we can guarantee that the same approach is guaranteed in all the process. So some aspect that it is important to highlight is that we need to have a multi-hazard approach to increase the response capacities. It is important and key to work with them and always work based on a strategic risk assessment. Otherwise, the planning process won't be really evidence-based sustainable. And as I said again, one of the important aspects is that no matter what happens in terms of strengthening IHR capacities, also is to ensuring continuity of health operations as one of the capacities to highlight in this aspect. So these are some of the strategic actions that we are working in general. At the left side, you will see the areas of work and that you may have been identified in the documents that Luri has mentioned and Adam as well, and also the areas of cross work as risk and crisis communication. This is a specific approaches, and also health security infrastructure, resilient and health workforce systems, and fragile and humanitarian environments. I will say these 1, 2, 3, 4, 5 areas of work that will be will be those that we will be focusing in the following months. So these are some of the strategic actions as region that we are having. One of important one is the involvement of the community, the training of local actors, as well of the strengthening of the health system as well. So I will stop there. Again, thanking for all the collaboration and all, of course, all the support that we have had. And I will say there is a lot still to share and also to learn from all of you. So now we are starting the phase 2, and thank you so much. We are really keen to continue this work. Thank you.
Okay, thank you so much, Alex, for sharing what is happening in PAO. 3 cities already in phase 1, and we note the work that you have done, starting with the STAR and engaging the city authorities, the workshops, the lessons learned. I think colleagues in Afro, this is something to learn from PAHO. We will share the presentation so that we can read this in detail, especially on the lessons and strategic actions as have been presented here in summary. Thank you very much, Alec, for that. If you have any questions, we are soon coming to open questions session. But before that, we'll call upon Ludi and Vivian to summarize in a few minutes what will be the next steps, given our understanding of the framework now, the priority countries, examples of what has been done, and so what is the next step? Over to you, Ludi and Vivian. We're not hearing. Yeah, okay.
So I would prefer to have Vivian first so we can listen to what Africa is moving forward. But however, in terms of global next step, so first of all, we would love to have a conversation with all the regional office, not limited to Africa, but it's all regional office too, because this is a global resolution. Particularly the 18 countries already interested to attend. And we're going to held this meeting in Zanzibar, Tanzania, hopefully by the 13th and 14th of June to give us a little bit of more time. What we are planning to do right now, we are already sharing with you on the draft reporting with all the regional office, draft reporting to the WHA in terms of the progress, but most importantly, next step that we are planning to do. So this reporting has to be, cleared within the HQ within this week and next week. And then we're working with the governing bodies in terms of to be part of the overall WHO Secretariat report. We are thinking to have a potential site event with the government of Singapore, who is the leader of the resolution, and then and really having a discussion at the ministerial level. How should the importance of we should address this issue of urban preparedness. Assessment tool that Adam and currently with other colleagues as well developing. We are the assessment is not going to be the same assessment like the national level, like SPAR and JEE. Assessment is not coming out with the new assessment. It's a very practical. This assessment is being developed in order to lead into investment directly. So in other words, it's not just an assessment for the sake of assessment, but assessment to see how many infrastructure that is available. It's not only just capacities. It's important, capabilities, capacities, and infrastructure. So that's the tool that we are developing. And then we would like to understand regional activities, priorities, as I mentioned, to identify one of the area cross-cutting that I show it to you, and that way we can support with funding activities and partnership and development partners that we would like to build in terms of community of practice at the local level, subnational level, and global level. So Adam, do you have anything that I might miss?
No, I think that covers everything.
Yeah, that covers everything. So at least for now, for this year, and then we have a continuous of events. We have an events in Bangkok, and this is an opportunity where cross-regional learning is important. How the Caribbean can inspire the Pacific. The Pacific can learn from the Cape Verde. The Cape Verde, then you create a truly solidarity in the future in the context of preparedness. With that, I thank you very much, Miriam.
Yeah, thank you very much, Rudy. Over to you, Vivian, on the next steps within the African region.
Slide, please.
Okay.
Is it on slideshow?
Not yet.
Not yet.
Maybe it's coming slowly.
Yeah, it's
But
taking
you can
time to
start.
load. Okay. Duplicate. All right. Yes, regarding the next step for the implementation of the framework in Afro, the plan is to get the framework implemented within our flagship project. And for urban preparedness, it is clearly linked with the PROS flagship project. A flagship, yes. So for countries who already conducted scoping mission for PROS, you're already familiar with the minimum and the core package of PROS. The minimum package includes risk assessment using the tools such as STAR, the GIRE, the GEE, the SPA, UHPR, and then development of the NAPs to align with emergency preparedness priority in the plan, and then operational readiness using the tools such as readiness intelligence and epidemic readiness checklist. The minimum package of PROS is very well aligned with the urban preparedness framework. The urban preparedness framework is highlighting 4 key areas of emergency preparedness or key activities of emergency preparedness where urban preparedness should be implemented. These are risk assessment, monitoring and evaluation, capacity building, and partnership. Therefore, in Afro, we are looking at 4 steps implementation approach. The first one being risk assessment, using already existing tools that we use for assessing risk at national level, such as the STAR, the GIRE, the mass gathering, to have the risk profile of the various cities. And then the second step is gap assessment. We are still using already existing tools such as the STAR, the GIRE, the CIMEX, the readiness intelligence, and even the after action review to identify critical gaps at the city level. And then when the gaps are identified, we need to build capacity, ensuring that those gaps are included in the various emergency preparedness plan, such as the NAPS operational plan, the IHR PVS National Building Workshop, and even the multi-hazard plan. After, to ensure that the activities are implemented within the country planning processes. And then after capacity building, now we need to ensure that there is a strong partnership between the local authorities at the national, the regional, and even the global level for experience sharing, for sharing best practices, and also for sharing lessons learned. And these platforms, some are already in place, like the Making City Resilience initiative, the Mayor Migration Council, but other platforms already exist, and the WHO GSPN, that's the Global Strategic Preparedness Network. Yes, so Ludi mentioned about the tool. So while waiting for the global tool to be finalized, we are going to be implementing urban preparedness within the emergency preparedness processes that we are already doing. And after that, then the tool will be piloted in some few countries, then will be evaluated. And if we have a positive outcome, then we will roll it out in the region. It's also worth mentioning that there is going to be a clear alignment. There is still going to be alignment with the current activities and the tool that is to come, because these key activities that I'm mentioning are already reflected in the guidance to local authority. So, somebody in the chat already asked the question around the timeline for implementation. We are still having an internal discussion, and as soon as we agree on the time period for the pilot phase, we are going to communicate with the countries. However, if urban preparedness is a priority to a specific country, even if that country is not included in the initial pilot cities that are selected, you just have to send a request to AFRO, and we will be happy to work with you and the national stakeholders to support implementation of the urban preparedness initiative. So that's the quick overview and summary of the next step and how we are planning to implement it in the Afro region. Thank you, and over to you, Dr. Miriam.
Okay, thank you so much, Vivian, for that. Just maybe to add a little bit that urban preparedness is important for every country. But we are prioritizing some to get to learn lessons as you have learned from PAO. But if you feel that you need to move, you can't wait for the pilot, you can move along with us. You can call for capacity for technical support, and technical support can be provided as necessary. I think this is what Vivian was trying to highlight. So any questions? We have a few minutes for questions, open questions, if there are any. Do I see any questions? Okay, I don't see any hands up. I don't know. Okay, I see 2 hands up. 3. We'll start with Kense. Kense from Botswana. Please ask your question.
Good afternoon, and thank you so much for this exciting presentations. We have learned a lot, and like it was said, that Botswana is one of those countries that have sponsored, and they would like to really start implementing this. But it's not a question. I just wanted to say I think we will need to sit with Vivian just to make some corrections in the profile of the city. So it's not a question, just to say that we noticed that there are some areas which we need to correct. Thank you.
Okay, this is noted. Vivian, a few corrections in the details of the city. Kola, over to you. Kola, you're muted.
Okay, thank you, Dr. Miriam, and thanks to Vivian for the great presentation. Just to add that to avoid any kind of missed opportunity, that I know that some countries are planning to conduct their subnational STAR, Lazarus assessment. So if any of those countries fall within the countries that you have listed, it would be good to quickly grab that kind of opportunity so that you can bring the context of urban preparedness into it. Thank you.
So good point that if we are planning urban preparedness and the subnational stars, I think we should prioritize the cities for some of these assessments. Julian, over to you, please.
Thank you very much. I hope you can hear me.
Yes, we can.
Thank you and congratulations really for this webinar and this new thematic and the challenges that we have in our continent. I'm just thinking about maybe see also countries who which are not really prioritized when we talk about emergency. We had recently the issue of Marburg outbreak in Equatorial Guinea, where we had the city of Bata, where we had a very critical situation, and it is a Spanish-speaking country, is a country that is not really used to be prioritized in our my suggestion is just to see how this type of country can be prioritized, because it's like a separate country because of the language barrier and the language challenges. But today we have this country in the middle, at the cross border of Cameroon and Gabon, and there is a country where we have the circulation of all the people for both the other three countries. Just, I don't know, to see the
Julian, that is noted. That is noted.
Thank you very much.
Okay, thank you very much. No other question, and I see that the questions many of the questions in the Q&A section have been answered. One last one: is this framework tailored to address the needs of urban refugees, IDPs, and migrant populations as well? So Vivian, you want to answer this quickly?
Yes, thank you for this question. Yeah, during Ludi's presentation, we highlighted the 8 key pillars or priority areas for urban preparedness. And yes, population, specific population is mentioned. So this internally displaced population can be addressed under that pillar. But also population movement is one of the key pillar in the initiative. Yes, it is well captured in the framework. And we can tell yes, activities to target those people with specific needs. Yeah, thank you. Over.
Yeah, thank you for that. In the assessments, typically all these would be captured as vulnerable populations and their issues addressed specifically in this urban preparedness. No other questions, colleagues, even time is gone. We want to thank you so much for your participation in this meeting. We thought that this new framework, new area of work needed to be introduced to all of us for our understanding and support in its implementation. I think we have a better understanding of what needs to be done. We have heard of priority cities, but it does not stop other cities from adopting and implementing this framework as long as it is applicable. And I think it is applicable in most of in all the cities, including the city that Vivian is talking about. It may not be among the pilot ones, but it is a city that should implement this urban preparedness framework. We need to look at it this way, that all cities are viable for this and they should take it up, only that we are starting with a few to learn lessons as we move on. And we need to integrate city in the risk assessments that we are doing if we are going to subnational level and all that. I would like to come to the end of this meeting, but I think I cannot close the meeting when my boss, Dr. Chamla, is here. Dr. Chamla, I wanted to ask you to give just a few remarks.
Miriam, you have to leave me alone sometimes. Okay, yeah. I also have to appreciate the presence of Alex from PAHO. Alex, we have attended a number of the meetings with him, and he's always in awkward hours. But I think we have tried our best this time, Alex, to have appropriate time to you in the DC, so we wouldn't be either, extremely early or actually extremely late. Yes, from me here, I'm really glad we have started the conversation about urban preparedness. I think it's a topic in which we had been brainstorming since the adoption of the resolution. And really, I have to appreciate our HQ colleague, Lodi Adam, there in a call, who they have been really spearheading this initiative, trying to bring us all on board. I think your efforts are really appreciated, Rudy and the team. And also we've learned a lot here from the POWER presentation, and also appreciate our OSL colleague here, actually also in the court, Fida, to let us know, or even to remind us on the issue of pre-positioning, in which is always staying toward the end of the crisis itself. Therefore, I'm really glad. I think the only point I need to add in the conclusion is opportunities ahead of us. So there will be a global technical meeting in which our expectation will bring appropriate stakeholders on a table, including donors. As a result, I feel it's an opportunity of partnership, of the networking, and also resource mobilization. Another opportunity is, I think in our Afro framework, we have to explore how are we able to add an element of urban infrastructure. And the reason I'm talking about it is because African Development Bank now has allocated a lot of resources on urban infrastructure improvements. And it is an area in which we have to explore on how are we able to actually optimize any opportunities ahead of that. It is an opportunity ahead of us. And also the other opportunity here, as you have understand, the governance class, the structure in countries, it really differs. However, in a lot of countries, we have the Department of the Local Government. And I think it is an opportunity for us in WHO now, actually, to have the partnership at the grassroots level. It's an area in which is so critical. I think Tanzania, for instance, understand the primary health care, and others are actually in a different ministry. As a result, I think it is another opportunity here we have to explore as well. So I will end up here. I think the message is clear. We really have to understand on the type of the risks in urban and the impact. And after understanding it, we also have to understand a type of capacities in which we are supposed to strengthen in the urban settings. I will end up here, actually, Manyunja. It was excellent moderation as usual, and actually all the best. And on the resources and priorities in Africa, I hope we'll have our roadmaps in which are costed, and in our level, we will actually try to see how we be able actually to mobilize the resources and support our countries. Over to you, Miriam.
Okay, thank you very much, Dr. Dick, for those closing remarks. Once again, colleagues, thank you so much for participation. Panelists, facilitators, thank you so much for the time and for the presentations. I think this was a very informative meeting. We congratulate you all for all that. And with that, we bring this meeting to a closure. We shall share the presentations to all. Thank you very much. Have a good evening and God bless you all.
Thank you, everyone. Goodbye.
Bye.